Introduce our next speaker. I want to take just a minute to maybe backtrack on something that Laura said. In the old days, back when we were beginning, people my age were beginning their professional career, almost all insurance was through employer insurance. And one of the reasons why employer insurance was cheaper was because all the employees of that company were included. Brand new young people, as well as people getting ready to retire. So you had both ends of the spectrum. You weren't kicking out the people that worked at the plant that had diabetes, but you had 20 people working that didn't have diabetes, so they were able to cover that. If the government takes out this mandate, what they're saying is, we're going to allow you to have an insurance that's almost like through your employer, but we're going to let the employee choose not to join until they get sick. And so when these young people that don't feel like they need insurance because they're young and healthy, if they're not in the pool, then the insurance agencies are automatically going to raise the rates because the remaining part of us are older, sicker, need more services. So the employer, and you know, the federal government keeps talking about, well, the employer mandate. Well, those employer mandates are to make sure that everybody's included. When everybody's included, then we have the support of the young, healthy people as well as the more experienced workers who might have more opportunity to have diseases and that sort of thing. We've talked about the state. We've talked about the problem. We invited Miss Chelsey Hogan to come. She's a local insurance person. She works with the Chastain Insurance. I happened to be driving up and down 129, and I saw a sign that said, "Sign up for Obamacare." And I said, I didn't know anybody in this county even knew what Obamacare was and really wanted it. So I stopped in and talked to those people, and they turned me on to Chelsey. And what I hope she's going to talk to you about is not theoretical, but what's going on in our county, and what are your options, and what can we talk to our friends and neighbors and people about, so that if they don't have coverage, we can help them get coverage. And so I introduce to you Miss Chelsey Hogan from Chastain Insurance.
Thank you so much for having me. This is not my forte of talking to big groups of people. I'm more of a one-on-one type person. So, like you said, I'm with Chastain Agency. We are a local independent agency. We have offices in Gainesville, Cleveland, and Cornelia. Lived in White County most of my life. Took a brief stay in Gainesville, and then married my husband and came back. In which we are expecting our first child in March, so we're very excited. Other than that, so let's talk about why we're here. What is going on in health insurance? And when we say what options do we have for health insurance? Individual health insurance, we have one. Alliant health plans. That is our only option, whether you are on exchange or off exchange. Okay? With that being said, there's not too much else out there for us to look at. And based on your income levels and where you fall, the number of people in your household, you could be eligible for the Obamacare ACA subsidies. Between 100 and 400% of the federal poverty level, you qualify for something. Okay? Alliant told me a statistic this year, 30% of their enrollment on exchange will be at a $0 premium. No premiums, and receiving a cost-sharing subsidy at that level. So we have two different ways to enroll: on exchange, off exchange. If we are on exchange this year, we are seeing major price reductions. Your premiums are going down. Off exchange, about a 60% increase, which is a hard pill to swallow when you're spending $30,000 a year for health insurance if you are not receiving a subsidy. A lot of people can't do it. Most people can't do it. So there is a big disconnect of how do we keep health insurance affordable for our lower income with these subsidies, but also affordable for people who don't qualify. And that's why we have elected officials and lobbyists and people to figure that out, people that are much smarter than me. So that's kind of where we're at in the insurance world, of what we're seeing on our level. So just for example, I just quoted today a household of 5, 2 parents, 3 children. They make about $85,000 a year. They were receiving $2,300 a month in subsidy, and they will be paying about $325 a month to cover their entire family for health insurance. They have a $73.50 maximum out of pocket. It's times 2 for the family. So their worst case scenario, $14,700 if everybody got sick. So that's kind of what our plans are looking like. But also on the flip side, I also spoke with a self-employed gentleman last night. He's in his early 30s, self-employed, pays himself about $50,000 a year. His premium's $600 a month. He's going to be one of the people who don't take coverage when this individual mandate is gone. And those are the people we need in the system to keep some pricing down. Okay. On the group side of insurance, we still have all of our carrier options, and different things. And Blue Cross Blue Shield, Alliant Health Plans, Humana, Alliance are only option on the individual side. And as you're looking at these pricing, especially on the individual side, you're like, wait a minute, that gold plan is cheaper than the silver plan. Why is that? Politics. That all happened at the federal level. When we signed an executive order a couple weeks ago, it took away the federal reimbursement for the cost share. And if you don't know what cost sharing is, there's 2 types of subsidies available to people. One is a monthly premium, and one is a cost sharing subsidy, which helps pay your deductible, maximum out of pockets, and some of your co-pays depending on your plan. You can only receive that at a silver level. That is the portion the federal government said they were not funding to insurance carriers anymore. Alliant Health Plans went into effect on October. They did not receive that anymore. October, November, and December, Alliant lost $6 million with a stroke of a pen. Now, Alliant is a very, very small company. Think of it on a Blue Cross level. These major insurance companies, they're not going to eat it. That's going to be passed along to us as the consumer, okay? Also realize that at that silver level, that is where you only get the cost sharing subsidy. The insurance carrier still has to honor that to us as a consumer at a reduced amount for our deductible and out of pockets. They're going to get it from the federal government because an insurance carrier is not going to eat that dollar. What they did was they put it in the premium of the silver level plan. The federal government is paying it when they pay the premium subsidy instead of the cost share subsidy. So when you're looking at your plans, gold's cheaper than silver because there's no cost sharing option. If that makes sense in any way. So that's what we're looking at. Bronze plans, I'm seeing $0 premiums all day. That family of 5 making $85,000 a year can enroll in a bronze plan at no cost to them. They can enroll in a plan with good co-pays, $200 or $325 a month. That's really what we're looking at with our options, which is really to say very little. And that's what we're seeing out in the market. If we're not receiving subsidy, pricing is crazy expensive. If you're receiving subsidy, very affordable and coming down for us. So I can't stress enough. I have people coming in my office saying, I was dreading this. I was here to tell you to cancel my insurance. I've seen the news. Don't do it. Come talk to us. See what the rates are for you. Also, because of the federal poverty levels and how that income is looking, somebody that wasn't eligible for subsidy last year may be eligible for subsidy this year, okay? So always check it every year and see. Now there is other options that are technically not health insurance that are available to us. Faith-based plans that are out there, short-term plans, indemnity plans, all that good stuff. Faith-based plans is not health insurance, but they do have a waiver from the federal government, so if a penalty is assessed, they do not have to pay it because they have the waiver. A fraction of the price, but it doesn't cover your pre-existing conditions. But it is out there for people that I say it's better than nothing, gets you catastrophic coverage, gets you something in case of an emergency. It's there for a reason, and I think it works for certain people. With that, in closing, anybody have any questions, I'll be happy to answer on a one-on-one or in a group setting. it's kind of a crazy world in the insurance life we're living now. So.